Big toe mobility for runners. Why does it matter? Running and walking both require sufficient movement at the big toe joint during the final stage of gait, or toe off. Extension at the big toe joint during this stage activates something called the windlass mechanism. You can see this windlass mechanism in this video, where the big toe is brought up and the arch of the foot raises. The windlass mechanism essentially enables the foot to form a solid lever to push off from, with what we call a high gear push off, as you can see in this video here. If you lack this mobility, there will be a tendency to push off from the outside of the foot with a low gear push off. This is not only inefficient, but can place a higher load on the other toes and on the outside of the foot. Runners that lack big toe mobility may complain of pain underneath the other toes of the foot or pain on the outside of the foot and ankle. How can you test your big toe mobility? Sit down with your foot flat on the ground and move your knee towards your toes to be level with them. Then pull your big toe upwards and measure the angle. You can do this with the Level app on your iPhone. How much mobility do you need? 30 degrees is minimum, with 50 degrees as optimal. How can you improve this? Firstly, you should have this assessed by a health professional to see if A, it needs to be improved. Are you running okay despite this lack of mobility? And B, can it be improved? Certain conditions can result in irreversible loss of movement at this joint, and trying to improve it would be futile and cause unnecessary discomfort. For these patients, an orthotic assessment or a rocker-soled shoe may be indicated. There are a few ways to improve this mobility. Number one is using a massage ball on the sole of your foot and further up the leg where some of these muscles originate. 2, hands-on mobilisation, grasping the big toe and forcibly bending forwards and backwards. And lastly, in the plank position on the toes and rocking back and forward to get the mobilisation through that big toe joint. For further assistance, please don't hesitate to contact us at healthhp.com.au.